Next is the fractures of the clavicle. You know, in the upper limb trauma, the most commonly fractured bone which is seen in day-to-day practice is the fractures of the clavicle, because the same reason, fall on outstretched hand. When the force is subjected and it is passed all the way up to the clavicle, then it will result in the breakdown of this bone into two of its component. All right. So fractures of the clavicle. Before we talk anything related to the clavicular fracture, it is important to have a discussion on some unique, peculiar features to the clavicle, which is anatomic. Like point number 1, what are those unique features of the clavicle? That it is the only horizontal long bone. You know, all the long bones are vertically aligned. This is the only long bone which is horizontally aligned. Point number 2, that it is the only long bone which ossifies by intramembranous ossification. You know, all the other long bones of the human body, they ossifies by enchondral ossification. But this is the only long bone which ossifies by intramembranous ossification. Point number 3, you know, you should be able to understand what is intramembranous, what is enchondral ossification. Like if there is a cartilaginous laying of the layers over to that, if the bony components are getting integrated, then this is known as intramembranous ossification. All right. Point number 3, that it is the only long bone without marrow, means there is no marrow cavity. So this is the only long bone which is not having any marrow cavity. All right. So these are the unique features of the clavicular bone, and this is also a long bone which has got two primary ossification center and a single secondary ossification center. So it is the only long bone which has two primary ossification and one secondary ossification centers. All right. So these are some of the peculiar features of this clavicular bone. Now let's talk about the fractures of the clavicle in particular. Now, as far as this fracture of the clavicle is concerned, we are not going to have a discussion on what is the mechanism of injury. It remains the same. More importantly, or most importantly, the point is that what is the most common type of the fracture? Means what is the most common location in which this fracture of the clavicle happens? So it is at the junction of medial 2/3 and lateral 1/3. So that is a junction of the medial 2/3 and the lateral 1/3 is the most common site where these fractures happen. Now imagine if the examiner is not interested in asking about the junctions, he is just interested in asking about whether it is happening in the medial, in the middle part or in the lateral part. So in that case, you have to write down the middle part. All right. So in the middle 1/3 of the clavicle, this is the most common site. But if the question language is asking about the junctions, then medial 2/3 and the lateral 1/3 is the most common site at the junction of this, where the fractures of the clavicle happens. Now, as far as the treatment is concerned, now the treatment more commonly, almost 95% of the fractures of the clavicle are managed conservatively. So conservative only. You can give elbow pouch. You can use figure of 8. All right. So figure of 8 slings can be used for the immobilization, or simple elbow pouch, arm pouch can be used for immobilization of the upper limb, so that the condition is rendered less painful. Over a period of time, this clavicular fractures will unite. Now this is conservative. Now as far as the surgical methods of fixations are required, surgery, that means fixation, is required only in several indications, and those indications are also relative. There is no such absolute indication for the management of the clavicular fractures by surgical fixation. So what are those relative indications? That if there is a displacement, of more than 2 centimeters, that is one of the relative indication. Then point number 2 is that if there is a neurovascular injury. Point number 3, based on the patient's consent, that if the patient is giving a consent that I want to get it fixed by surgical means, so if the patient is interested, all right, so these are considered to be the relative indications for the fractures of the clavicle, and if it is associated with the floating shoulder. Floating shoulder means there are associated fractures of the scapula also. Alright, we will come to have a discussion on what the floating shoulder is. So, these are the relative indications. Now, as far as the complications are concerned for the fractures of the clavicular bone, you know, every time they ask you about the clavicular fracture, then most common thing which is likely to happen with this clavicular fracture are the complications. You see, when we have talked about the clavicular fracture, like this is the clavicular fracture, and it can be managed by either a sling in a figure of 8 pattern or the elbow pouch which could be provided, all right, for the purpose of immobilization for the period of around 3 weeks to 5 weeks. But this surgical method of fixation is required with the relative indications. Now imagine if the patient is not managed surgically, then it will lead to several complications. So what are the complications? The most common complication which is found to be associated with the clavicular fracture is the malunion. It is the malunion, because imagine if this is the fracture of the clavicle and it is left to be united by itself, then it will lead to a malunion kind of the fixed union at the fracture site. Alright, so the fractures are going to be malunited, as a result of which what you will see is a bump. Now, as far as the stiffness is concerned, as far as the movement of the arm is concerned, it is not going to be hampered because of this malunion. It will only appear as a bump. As far as functional activities are concerned, it will be absolutely normal. Point number 2, that what is the name of the classification? You know, what is just the name of the classification for the fracture of the clavicle? It is classified by Allman classification. Alright, so fractures of the clavicles are classified by Allman classification. So you need not to go into the details of these clavicular fractures too much. All you need to have a discussion on is that how these clavicular fractures are managed, what are the unique points related to the clavicular fracture, and what are the complications. As far as the complications are concerned, there are numerous other complications, like it can lead to neurovascular injury, it will lead to a bump which will appear, alright. Related to the fixation, it can result in infections also. But all these complications are something which you need not to recall again and again. What you have to remember related to the complication is the malunion. That malunion is the most common complication which is likely to happen. Now, read out this question, that all of the following are the components of the floating shoulder except, you know, so what as a topic we are about to discuss is the floating shoulder. You know, the floating shoulder has got 3 components. One is there is a complete fracture of the clavicle. 2, that there is a complete fracture of the glenoid. Now, glenoid is a part of the scapular bone. So, there is a complete fracture of the glenoid, because in your options, instead of specifically marking the word glenoid, they can give you fractures of the scapula also. And the third one is associated soft tissue injury. Now, those soft tissues are going to be like, there could be a presence of acromioclavicular ligament, coracoacromial ligament, the glenohumeral ligament. All these ligaments could be disrupted. So, it will lead to a floating shoulder. Now, what are the components? If you look back to the question, that all of the following are the components of the floating shoulder except, you know, complete fracture of the clavicle is a component of the floating shoulder. Fracture of the glenoid is a component of the floating shoulder. But fracture neck of humerus, you know, humerus is nowhere given that it should be fractured so as to call it as a floating shoulder. Alright, so fracture neck of humerus is not the correct answer in this particular question. And yes, associated ligament injuries are always going to be there. If you look at this picture, so this is the picture of a floating shoulder. Like there is a complete fracture of the clavicle, there is a complete fracture of the glenoid also, but the humerus is absolutely normal. Now, why is it called by the name of a floating shoulder? Because, you know, the entire assembly of the shoulder joint is associated to the axial skeleton, is connected to the axial skeleton through this clavicle and the scapula. Now, if there is a breakdown of the clavicle, if there is a breakdown of the scapula, then this entire assembly will no more be connected to the central or the axial skeleton. That is the reason why it is called by the name of floating shoulder. So, hope you have understood everything related to the floating shoulder. We are expecting this topic with this question to be kept in your examination in the near future. Now, next, before we talk about the next topic, it is important to have a discussion on the most commonly asked question related to this particular topic. Now, what is the name of the nerve which is likely to get injured when you are provided with this kind of the X-ray? So, all you have to identify is that what is the name of the bone which is injured, what is the name of the bone which is fractured. So, if you look at this bone, the name of the bone is humerus and it is having a fracture of the humerus in the proximal part. So what we are talking about is the fractures of the proximal humerus. So the heading is fractures of proximal humerus. Now it is again not very difficult to have a discussion or understanding of that fractures in the proximal humerus will be because of the same mechanism, that is fall on outstretched or fall on abducted and externally rotated arm, that will result in the buttressing of the head of the humerus against the glenoid, which will result in the breakdown of this bone. That is point number 1. So the mechanism remains the same, that is fall on outstretched arm. Alright. Now point number 2, that is the mechanism. Now point number 2 is that what is the name of classification? You know, the name of classification for this proximal humerus fracture is the Neer classification, NEER. Now Neer has classified the fractures of the humerus into numerous types, multiple types, but what you have to remember is that what is the Neer criteria for displacement? The Neer criteria for displacement is, the Neer criteria for the displacement is that if there is a displacement, that means if there is a separation of 2 or more than 2 centimeters, 1 or more than 1 centimeter in between the fragments. If any of the fragment of the humerus is separated by more than 1 centimeter, it is said to be a displaced fracture. And second is that if there is an angulation of more than or equal to 45 degrees. Imagine if this is the proximal part of the humerus, this is the normal proximal part of the humerus, and here we are having a fracture. Now because of this fracture, what is happening? That there is a separation in between the two fragments. Now if the angle which is created in between the two fragments is more than 45 degrees, it is said to be a displaced fracture. And second, if the distance in between these two fragments is greater than or equal to 1 centimeter, then it is said to be a displaced fracture. Alright. So this is what you need to remember in Neer criteria for displacement. As far as Neer classification, which is categorizing the fracture into 4 types, is concerned, that's Neer type 1, it is 2-part fracture. Neer type 2 is 3-part fractures. Likewise, Neer type 4 ultimately is a comminuted fracture. So no one is going to ask you about the Neer classification. What is interesting, which could be kept in your examination, is what is the criteria. Then third one is obviously the complications. Now as far as complications are concerned, and a complication which will always happen in case the proximal humerus is fractured, one of the complication is stiffness. Now stiffness is considered to be the most common complication. Apart from this, another complication is the malunion at the fracture site. Imagine if there is a fracture and it was not adequately fixed, it was managed conservatively by the application of the long U slab, then in that case malunion is considered to be the most common complication. And the third one is the nerve injury. Now the nerve which is likely to get injured because of the proximal humerus fracture is the axillary nerve. So the nerve which is likely to get injured is the axillary nerve. Now if you go back to the question related to the proximal humerus fracture, now what you see over here is that there is a fracture of the bone in the proximal part of the humerus. What is the name of the nerve which is likely to get injured? Is the axillary nerve. So it is not very difficult. All you have to do is identify the bone, because once you have identified the bone or the joint, then axillary will be the obvious answer for that particular question. Now next is, what is the name of the nerve which is likely to get injured when you are having a fracture of the mid 1/3 of the humerus? Now before we go with the fracture of the mid 1/3 of the humerus, what we tend to see over here is that there is a managed proximal humerus fracture by putting a buttress plate. This is a locking plate in the proximal aspect of the humerus and it is managed by surgical means. Alright.